The vast majority of people are born with a normal, healthy heart that, as long as they look after it, will last for many years. Mother Nature has taken hundreds of thousands of years of evolution to develop your heart along with the rest of your body. Your heart is like the human brain and is one of the wonders of our world. And as long as it has oxygen, your heart can keep on pumping even if removed from your body. Perfected by nature to become arguably the most important organ in your body. Your heart is a large muscle that pumps blood containing oxygen and other essential substances to all the organs and cells of the body. Not just that, it provides the means of removing the waste that is provided by day-to-day bodily functions. Over a normal person's lifetime, their heart will pump enough blood through their bodies to fill 3 super fuel tanker ships. A normal, healthy adult heart will pump about 5 liters of blood through the body's blood vessels every minute, sometimes more when being very active or doing exercise. Being born with a healthy heart is nature's gift to us, but it's our responsibility to maintain, nourish, and protect it. The human heart is built to last for the whole life of our body. Modern medicine has perfected ways to repair it as well as replace it by using bypass operations and transplants. But it is much better to just look after it in the first place rather than go through the pain and expense of these operations. This video course is designed to help you understand a little of how your heart works, some of the problems it can encounter, and the best ways to ensure you have a healthy heart. Remember, it is never too late to start looking after your heart. Even if you have neglected it for years, your body is capable of fixing many of its problems by itself if you give it the right raw materials and remove the things that disrupt, pollute, and aggravate it. We'll learn about what is a heart attack or myocardial infarction. Heart attack is the death or necrosis of a segment of heart muscle due to the loss of blood supply. The blood supply is usually lost because a coronary artery, one that supplies blood to the heart muscle, is blocked by a blood clot, or coronary thrombosis. If some of the heart muscle dies, a person will experience chest pain and electrical instability of the heart muscle tissue. Heart disease is a very general term used to describe all the different disorders and diseases that can affect your heart and its operation. One of the most common causes is oxygen starvation. This is usually from the result of a blockage in the arteries that carry the flow of oxygen-rich blood from the lungs to the heart. This condition can lead to heart damage if left untreated. The damaged heart will undergo necrosis. In other words, the heart cells will start to die. Oftentimes, this condition is caused by a buildup of a waxy substance known as plaque. Usually it takes many years for this substance to build up to the point where it becomes a problem and blocks the coronary or heart arteries. The medical term for this phenomenon is atherosclerosis. When an area of plaque builds up, it can cause irritation and swelling, and eventually it can rupture. This starts the body's natural defense system within the body forming a blood clot around the area. If the clot becomes big enough, it can result in the artery being partially or totally blocked. This condition, if not treated quickly, can result in the areas of the heart that rely on being fed by this artery beginning to die, with otherwise healthy tissue being replaced by scar tissue. Sometimes this condition is not obvious, so it's not discovered, leading to long-lasting heart health problems. A heart attack, or MI, can be caused by many congenital conditions or conditions that were present when a person was born, as well as those that develop over a lifetime, such as angina. Now let's talk about the symptoms of a heart attack, or MI. It should be pointed out that everyone is different, and some people will have no symptoms at all or experience very mild symptoms. Often this is referred to as the silent heart attack, as it usually happens with people who have diabetes. Common symptoms most people experience when having a heart attack are as follows: chest discomfort or pain, Sometimes people will experience a sudden sharp pain, and other people will have a mild but noticeable chest pain. The feelings can last anywhere from just a couple of minutes up to 3 or more hours. Discomfort in your upper body. Many people feel discomfort, distress, or uneasiness in one or more parts of their upper body, such as the jaw, neck, shoulders, back, or arms. Sometimes people also feel this in their upper stomach. Shortness of breath. Often people have shortness of breath with or without chest pains. Sudden feeling of dizziness. Having cold sweats and nausea or vomiting are symptoms more common with women and people who are overweight. Feeling unusually tired. The feeling of being tired or weary with no apparent cause and often waking after a long sleep, feeling tired. This feeling can sometimes go on for days at a time. Often people, especially older people, will experience some of these symptoms and will just ignore them thinking they're signs of aging. But it's important, if you feel any of these symptoms, even mildly, to seek medical advice, especially if they are severe or you experience more than one of these symptoms. So how to diagnose a heart attack or MI? These are some of the symptoms of a heart attack or MI that are often included when someone is having a heart attack. If you have only one of these symptoms, you are probably not having a heart attack. If you experience any of the following, it is wise to have a medical checkup. If you or anyone you know is having 2 or more of these symptoms, then it is advisable to call emergency help right away. Prompt medical care and treatment can prevent or limit organ damage and may even save your life. It's better to be safe than sorry later. If you are having difficulty breathing or shortness of breath, feeling weak or fatigued, feeling that you are unusually tired with no apparent reason for long periods of time, even after sleeping, swelling in your feet, ankles, and legs, edema, feeling an irregular or rapid heartbeat, a reduced ability to do normal exercises, having a persistent cough or wheezing, often with white or pink phlegm. You may feel confused or fuzzy, lightheadedness. Sometimes people find it hard to concentrate and stay alert, often seeming to daydream quite often. Losing consciousness, fainting, blacking out, or passing out. Your heartbeat may suddenly change for no apparent reason. It could slow down, start to beat faster, or beat rapidly and continuously. You could feel cold or start sweating. Your hands and feet feel cool or cold. You may have a weak pulse. You can feel nausea and experience vomiting. Your urine output may decline or cease altogether. Most people who experience heart attacks feel discomfort on the left side or the center of the chest. It can feel different for different people. Sometimes it manifests as pressure, fullness, or a squeezing sensation, often with pain, while other people feel indigestion or heartburn. These feelings usually last for a while and often go away and then return. Often people are unaware they have had a heart attack, as not all heart attacks start with a sudden sharp pain in the chest, as seen in some movies. Everyone is different, and each person will have their own set of circumstances that will dictate how their condition will manifest and which symptoms they will have. Often people have few symptoms, and they're surprised to learn they've already had a heart attack when they visit their doctor for a routine checkup. If you are aware you or someone near you is having a heart attack, do not take them or drive yourself to the hospital. With severe heart attacks, every minute counts, so if possible, call a hospital and have an ambulance and medical team come to you to start treatments as soon as possible. They usually begin immediately, even on the way in an ambulance going to the emergency treatment room in the hospital. What are the common causes of heart attacks or MI? Apart from trauma from accidents or misadventures, such as damage caused to the heart during a heavy fall, in a motor accident when the body is slammed into the steering wheel or stopped abruptly with a seat restraint, or some birth-related conditions, most heart disease is directly caused by dietary and lifestyle choices. The most important things to avoid are too many processed foods, such as avoid refined salt. Use only natural, unprocessed sea, rock, or Himalayan salt. Avoid all refined vegetable oils. Use only cold-pressed or centrifugally extracted coconut, palm, or olive oils. Avoid refined carbohydrates, especially white flours and products. Avoid artificial preservatives, flavorings, and colorings. Avoid processed and factory-raised livestock. Avoid smoking or other people's secondhand smoke. Avoid or use alcohol in moderation. Try and minimize emotional stress as much as possible. Chest pain, cardiogenic versus non-cardiogenic. Most people experience chest pain to some degree at one time or another over the course of their lives. This is often caused by anxiety because chest pain is so often associated with heart disease. Fortunately, almost all chest pain has little to do with the heart, but it is not something you should ignore. Understanding the difference between the different types of chest pain, those pains that are considered to be heart-related and those that are not, can reduce stress and anxiety, both of which are major contributors to heart disease. The chest and lung areas are made up of many different structures, all of which can produce pain. The most common types of pain and/or tenderness is in the muscles and bone joints around the chest. The lining or pleura around the lungs can be associated with pain if it becomes inflamed or irritated, but the lungs do not contain any of the nerve connections that will induce the feelings of pain. The esophagus, or the tube from your mouth to your stomach, is another area in your chest that can give you pain. Heartburn, as it is often referred to, or refluxing, has nothing to do with your heart, but can often give a pain that feels like a heart disorder. The esophagus can also have or give spasms, which is also non-cardiogenic. Cardiac or heart-related chest pain is more often experienced in the morning. Symptoms include a dull, constricted pressure with burning or squeezing sensation. Instead of superficial pain, people usually find that the pain comes from the deeper areas of their chest. However, it can be difficult when it comes to describing the location of the pain. It may feel like the pain originates from all areas such as back, neck, head, or throat, or even from the arms, often the left upper arm. Not knowing where the pain comes from, people commonly describe that the pain came out of nowhere. Chest pain is often brought on by some form of exertion like carrying a heavy bag, sweeping, or digging. Extreme temperature while exercising or working can also cause a heart attack. It can also follow after eating a heavy meal, then doing some physical work. These types of pain usually last as long as the physical activity you are doing continues, but in most cases reduces quite quickly once the activity that has brought it on is stopped. Some forms of heart-related pain, such as angina, can be aggravated by lying down, but standing or sitting and even leaning into the discomfort area can help to relieve it. If you feel these types of discomfort or pain, then it's very important to seek medical help urgently. Other types of chest pain that are not related to the heart most often manifest in or towards the end of the day. The pain often feels much sharper and is usually in one area that can be identified easily. This type of pain normally occurs without any real warnings or specific reason apart from doing an unusual activity or lifting and stretching at angles you are not used to. Heartburn may develop after eating oily or high carbohydrate foods. Often these types of pain come and go quickly, sometimes lasting only a few seconds or minutes. At other times they may remain for several hours. Simple exercises, especially breathing exercises, will often help to relieve or stop this type of pain altogether. It will usually respond well to analgesics such as aspirin and heat packs. What your medical professional will do. Your health professional will usually ask you a series of questions such as your age and sex, ask about your eating habits and your physical history. They will take your vital signs such as weight, blood pressure, temperature, and may do a test to determine your body fat ratio. This is so they can make a realistic assessment of your condition. If you're a 25-year-old gymnast or martial arts student who has just started lifting weights and doing a bodybuilding course, then it's safe to assume that your pain is muscular in origin. If you happen to be a 56-year-old male who is a heavy smoker and drinker, as well as someone who does little physical work, a high-stress job, and also has high blood pressure, eats mainly processed foods, as well as having a family history of heart disease, then it is safe to assume that your health professional is going to be looking for a heart-related reason for your pain. This is because you would be at the most risk of those who may have a heart attack. You'll probably be asked to undergo a variety of tests and possible chest x-ray to find out what your problem is and work out ways to remedy this. It's very important, if you have any of the symptoms of heart disease and or are experiencing chest pain, you should get your medical health advisor to examine you if you experience more than 2 of those symptoms. In the cases where it's found that there is a heart problem, then finding it early and treating it will give you the best chance for a full or satisfactory recovery over the shortest possible time. We'll talk about complications of a heart attack. Heart failure doesn't necessarily mean that your heart has stopped beating or working. It's a condition when someone's heart is unable to pump enough blood around their body to meet all their bodily needs. Heart failure can cause many complications to all the body organs and parts because when the heart fails, they are starved of the oxygen-rich blood they need to survive. Areas such as the brain, lungs, kidneys, skin, and nervous system can be affected. The veins in the arms and hands, legs and feet, abdomen, and neck can also be affected, often become swollen. Heart failure can cause shortness of breath, especially when doing physical work, with the amount of the loss or shortness of breath increasing with the level of exertion undertaken. Valvular heart disease. This condition is where the valves in your heart that control the free flow of blood are not working properly. The valves of the heart ensure that your blood freely flows in a forward direction and cannot leak backward. The way in which the healthy heart operates is the same for everyone. The heart contains 4 chambers, with the heart valves placed at the exit of each chamber. Your blood flows from both your right and left atria into the ventricles through the open mitral and tricuspid valves. When your ventricle chambers are full, the valves shut, stopping blood returning to the atria when the ventricles contract. When the ventricles start to contract, the aortic and pulmonic valves are forced to open. The valve from the left ventricle goes into the aorta and then to the rest of the body after passing through the aortic valve. The blood from the right ventricle goes into the pulmonary artery through the pulmonic valve. Once the ventricles have finished contracting and start to relax, both the valves shut, preventing any blood from flowing back. This pattern is continually repeated over and over for the full life of the person. There are 2 main types of heart valve disease. 1, valvular stenosis, and 2, valvular insufficiency. Valvular stenosis occurs when 1 or more valves are narrowed, stiffened, thickened, or blocked. This can lead to the heart having to work very hard to pump enough blood through to the different body parts. All 4 of the heart valves can develop stenosis. The other common type is valvular insufficiency, sometimes called either regurgitation, incompetence, or leaky valve. This happens when the heart valve does not seal or close properly, allowing some blood to be forced or leak back into the chamber. If this condition worsens, it forces the heart to work harder to supply the needed blood to the body. Some forms of heart valve disease are congenital, while others may only be detected later in infancy. Other forms can develop during a person's lifetime. However, the cause is still unknown, but it's definitely linked to inadequate diets and sedentary lifestyles. This form of the condition usually affects pulmonic or aortic valves. Sometimes they can have defective leaflets that are deformed, they're an incorrect size, or not attached properly. Sometimes people are born with bicuspid aortic valve disease. This is where there are only 2 leaflets instead of the normal 3, often causing the valve not to open or close properly or tightly. Acquired valve disease occurs when the valves that were normal at birth and in early life have changed or developed complications. This can occur from a variety of reasons, mainly infections or diseases, including rheumatic fever, caused by an untreated bacterial infection such as strep throat. Often, this type of infection in childhood, if left untreated, can quickly lead to inflammation of the heart valves. Often, the symptoms of this type of infection and irritation do not manifest for 20 to 40 years later. Another heart valve disease is known as endocarditis. This occurs when harmful bacteria enters the bloodstream and then attacks the heart valves. It can result in holes and growths developing, as well as subsequent scarring. This bacterium is often able to enter the bloodstream because of IV drug use, dental procedures, surgery, or severe infections. A very common condition is called mitral valve prolapse. This is a condition that is known to affect about 1.5% of the general population. This condition causes the leaflets of the mitral valve to move back into the left atrium when the heart contracts. It also often tends to make the tissues that make up the valve stretchy, causing the valve to leak. Normally, this condition does not become problematic and does not require treatment unless there are other complications. Another thing that can affect the heart valves are some sexually transmitted diseases such as syphilis. High blood pressure can also contribute, as can many types of drugs, both prescribed and over-the-counter and illicit. Cardiogenic shock is a condition in which your heart suddenly can't pump enough blood to meet your body's needs. The condition is most often caused by a severe heart attack. Cardiogenic shock is rare, but it's often fatal if not treated immediately. Fortunately, about 50% of people who develop this condition will survive if immediate help is available. The most common cause of cardiogenic shock is damage to the heart muscle from a severe heart attack. Only about 7 to 8% of people who have a heart attack will have cardiogenic shock. When people die from heart attacks, it's usually due to the cardiogenic shock, not the actual heart attack. Because of this shock, the body has a very low blood pressure. Another type of shock, hypovolemic shock, is where the heart cannot pump enough blood because of blood loss, usually from trauma. Vasodilatory shock is when the blood vessels relax abruptly, causing blood pressure to become so low that there's not enough pressure to pump the blood to areas that need it. This can be caused by a bacterial infection in the bloodstream or a severe allergic reaction to certain substances. This can also occur when the nervous system is damaged. When someone is suffering from this type of shock, regardless of the cause, it means not enough oxygen is reaching their vital organs. They only have a few minutes before the lack of oxygen starts to do damage that is usually not repairable. If it's not treated quickly, it's likely to cause permanent organ damage or death. If you know or think a person is in shock, call an ambulance so they can get treatment quickly. Do not delay with calling for help or try to transport them yourself unless there is no other option. A blockage in the pulmonary arteries of your lungs is called a pulmonary embolism. Usually, a pulmonary embolism is caused when blood clots from the legs and sometimes other areas of the body, deep vein thrombosis, travel to the lungs. A pulmonary embolism can reduce or block the blood flow to the lungs, becoming a life-threatening condition. With prompt and expert treatment, the chance of this condition resulting in death are greatly reduced. One of the best ways to prevent a pulmonary embolism is to take adequate measures to prevent blood clots in your legs. If blood clots are formed, quickly eradicate them. Arrhythmia is the term given to a condition where the rhythm of your heartbeat changes. This can happen when your heart rhythm is too slow, too fast, or if it has an irregular rhythm. Sometimes an arrhythmia can cause your heart to just stop beating, which is called sudden cardiac arrest, or SCA. If it's not treated immediately, it can cause a loss of consciousness and death. Broken heart syndrome. This condition is named because it can happen to someone who has no history of heart disease and tends to happen quickly. The most common signs of this are chest pains and shortness of breath. Sometimes it's accompanied by a cardiogenic shock or arrhythmias. The other symptoms of broken heart syndrome tend to differ from those of a heart attack. The symptoms occur abruptly after experiencing extreme physical or emotional stress. The results of an electrocardiogram, or ECG, which is a test to observe the heart's electrical activities, are usually different from those who have had a heart attack. For instance, those who have had a heart attack in the past will show a deep Q wave in their ECG graph. When tested, there are no signs of coronary arteries being blocked. There is usually unusual movement and possible ballooning of the left ventricle or lower left chamber of the heart. Usually, the recovery time is relatively quick, often within a few days or weeks, as opposed to a heart attack, which usually takes a month or more. Arteries often harden as a person ages, losing their suppleness and elasticity over time. Although smoking is thought to be one of the major contributors of this condition, the exact cause remains unknown. Chemically derived drugs are believed to be another contributor, along with a poor diet, or a diet that contains a large amount of preservatives, artificial flavors, and colorings. Myocardial aneurysm. An aneurysm occurs when a blood vessel has been weakened, causing it to swell and fill with blood. Often these are formed after a heart attack. They often occur around the base of your septum or in the aorta. This can cause a constriction of the blood flow to the body, resulting in heart disease. Aneurysms become lined with scar tissue, which usually stops them from rupturing. Ventricular aneurysms generally grow slowly. The common symptoms are tiredness, lack of energy, and stamina. Blood clots can form inside some ventricular aneurysms, which can lead to serious complications and even death, especially when the blood clots break away and spread throughout the bloodstream. Some aneurysms are congenital, while others are caused by a heart attack. The blood clots formed around them can block the blood vessels, resulting in restricted movement and tissue death in a limb, a stroke, ventricular aneurysm, or arrhythmia. We'll learn about emergency care. So, what can you do if someone is having a heart attack? Oftentimes, there won't be obvious signs of pre-heart attack. This disease is usually asymptomatic until the later stage. Early signs of heart attack include feeling pain or discomfort in his or her chest and shoulders, tiredness, lack of energy, breathing difficulty, and so on. Everyone's complaints might differ, but when heart attack actually happens, one would experience sharp pain on his or her left chest for at least 15 minutes. Men and women have different symptoms. Often women do not experience any chest pain. Their symptoms are fatigue, disturbed sleep patterns, shortness of breath, indigestion, and anxiety issues. If you think you're having a heart attack, call emergency services right away. Do not wait, as every minute counts. A person's treatment options and chances of full recovery can be reduced by the delay of treatment. Call emergency services and talk with the operator who is trained to assist you. The 6 signs of heart attack. So, how do you determine whether a person is suffering from a heart attack? Here are the 6 signs of heart attack that you can take note of. Heart attack sign number 1. Chest pain or discomfort. For men, chest discomfort is the most common symptom of a heart attack. Usually, it's felt as a tight, heavy, or burning sensation. This usually starts in the middle of the chest, then moves to other areas of the body. Sometimes it's continuous, sometimes it goes away and then returns. Some people experience no pain at all, just discomfort or a dull type of pain, which can grow to be quite intense. Others will not have pain, just discomfort. If you think you're having a heart attack, call emergency services right away. If it's only chest pain, the person will still need to see a doctor. Heart attack sign number 2, discomfort or pain in other parts of the body. The symptoms of a heart attack can also manifest in different parts of the body, such as one or both arms, the neck, jaw, back, or stomach. Different people, especially women, will experience pain or discomfort in the jaw or back during an attack. Heart attack sign number 3, shortness of breath. After someone does physical work, it's normal to have some shortness of breath. If this happens when you are resting, it's often a sign of heart failure. If your breath becomes unusual, take a short rest to normalize your breath. If your breathing does not become normal after 2 minutes, call emergency services. Heart attack sign number 4, nausea, sweating, or clamminess. Many people, especially women, when having a heart attack will feel nauseous, excessive sweating, or clamminess. These symptoms can also be indications of the flu, but if these symptoms occur abruptly, or if you also have other indications of a heart attack, call emergency services immediately. Heart attack sign 5, a general feeling of extreme fatigue or weakness. Sometimes the first complaint you may hear from a heart attack patient is general weakness or fatigue. It might not sound like much, but this is a common indication that most potential heart attack patients experienced prior to the attack. But this symptom alone is not enough to diagnose or expect a heart attack, as there are too many causes of weakness and fatigue. It could be due to lack of oxygen, not having enough sleep, poor eating habits, anemia, arthritis, and others. But if other signs of heart attack are present, do not hesitate to call for emergency services immediately. Heart attack sign number 6, collapse or falling. Often a person with heart attack will collapse or lose consciousness, unlike other chest conditions where this rarely happens. Again, if you find someone collapses and lose consciousness, bring him or her to an open area and call for an ambulance right away. Early warning signs of a heart attack. Heart attacks usually give a bit of a warning before they happen, except with heartbreak attack. Often this can happen days or in some cases months before an attack is imminent and the heart muscle becomes damaged. High blood pressure is a sign of possible heart disease. Chronic heartburn can be an indication of heart problems. Reduced cardiovascular fitness and shortness of breath. High blood LDL cholesterol levels. The feeling of being unwell or run down before a heart attack. There are lots of reports of people feeling a sense of impending death before experiencing a heart attack. This is quite common and may have something to do with depression, which is also an indicator of heart problems. Abdominal pain and indigestion is a common sign, especially for people over 55. Because of the similar symptoms in many different conditions or diseases, it can be hard to tell that you are experiencing a heart attack. So, look for several symptoms. The more symptoms you have, higher the chances you are having or will have a heart attack. Routine checkups from your health provider are advisable for prevention and cure. What to do before help arrives. Having a heart attack is a traumatic experience. Often people will panic when having a heart attack, so try to remain calm. If you are helping someone, assure them that help is on the way and that things are okay. It will help calm them. Keeping calm is important. The best recovery position is when sitting in the W position. This is with the back supported at a 75-degree angle and the legs bent so the knees are up and the feet flat on the ground, forming a W shape. Another position that is recommended is to lie flat on your back with your feet up above your heart, the Venus position. This opens your diaphragm, it makes breathing easier, and increases the oxygen supply. Once the person is comfortable, all tight-fitting clothing should be loosened to avoid any restriction, but do not allow them to chill, so ensure the person is covered. It is important that the person does not walk around. Lying or sitting in a relaxed position without pressure on the lungs is best. Do not ask unnecessary questions or distress the person, but do check for any medical bracelet or tags and try to find out if they have any medical condition or are carrying any medicines. If someone is expecting a heart attack, they may be carrying aspirin or nitroglycerin. Usually they will know the required dose. Help them to take a small amount. If a person's heart stops beating, it becomes necessary to start CPR, but it is important that a person administering CPR is trained correctly. If you do not know how to do CPR, then doing heart compressions is the best option. When CPR is administered, as soon as a person's heart stops beating, even before help arrives, the person's chances of survival are drastically increased. What to do if you are having a heart attack when alone? Most people are alone when they have a heart attack. The first thing you should do is call emergency services. Give your location first, then your name, and try to state your problem. Only after you have summoned emergency services should you call others such as friends or family. The emergency service operator is trained to help you in cases of emergency, so follow their instructions until help arrives. If you are completely alone and do not have a phone, there is still one thing you can do that may save your life. This self-procedure is controversial, but it has been suggested that it could make matters worse if not done correctly. But if you are alone and there's no one available to help, then this is a viable option. Take a very deep breath and then cough vigorously right from the bottom of your chest, the same way a cat will cough to get rid of a fur ball. For this to work effectively, the person needs to take a very deep breath, about every 2 seconds. Breathe in and make a deep, prolonged cough. This procedure has to be maintained until help arrives, or your heart regains a regular rhythm and is beating normally. What this procedure does is to bring a large amount of oxygen into your lungs. The coughing squeezes the heart and keeps the blood moving. This squeezing pressure on your heart at about every 2 seconds will help your heart regain its normal rhythm. By doing this, you should be able to get to somewhere where you could find or call for help. Talk about risk factors for heart disease. There are many risk factors that you do not have any control over, such as your family history and age, but there are many factors that can contribute to the likelihood of having heart problems or a heart attack. Therefore, to reduce the likelihood of heart attack, you have to change your diet, lifestyle, and attitude. Most people will have at least one condition or habit that is a major risk factor for developing heart disease. Each one increases your chance of developing MI, as each risk factor you eliminate will substantially reduce your chances of heart disease. Now, let's talk about the risk factors for heart disease. Genetic or family history. If you have a family history of people with heart disease, this can increase your chances of developing a similar type of condition. But it does not mean that you are destined to develop a heart condition. It only means you're more likely to have this condition. If you take the necessary steps to look after your heart, you can reduce the chances of developing all forms of heart disease. After menopause, some women are more likely to develop heart problems because at this stage of their life they are producing less estrogen, so they need to vary their diet accordingly. Statistics have revealed that African Americans are a group that has higher instances of diabetes, high blood pressure, heart attacks, and strokes than other groups. Obesity and its effects. Obesity is a growing global problem. Someone who is obese has 4 times the likelihood of developing heart diseases. Furthermore, those with a family history of high blood pressure or diabetes will have a higher risk for heart disease. Obesity is now recognized as an inflammatory disease. It's often thought to be a symptom or indication of other conditions a person may have, not as it used to be considered just an eating disorder. Different studies have confirmed that obesity is a major contributor to causing heart disease and heart attacks. Poor diet, the wrong foods, clogged heart vessels, strokes. There is absolutely no doubt that having a poor diet or a diet that is deficient in many vital nutrients is a leading contributor to the extremely high incidences of heart disease that have become a reality for many people today. Our foods have been stripped of a large portion of their natural goodness by processing and artificial methods used to grow them. Processed salt, highly refined grains, high fructose corn syrup, and refined vegetable oils are the 4 poisons that are found in most of our diets. The combination of these clog up the arteries and blood vessels of the lungs and heart, causing heart disease. Smoking. Everyone is aware that smoking is likely to damage your lungs, but many do not seem to realize that it's also one of the leading reasons for people to have a heart attack. In fact, about 1 in every 5 people who die from a heart attack do so because of smoking. If you smoke, you are at least 4 times more likely to get heart disease than non-smokers, and the risks are even higher for women who take birth control pills. Secondhand smoke exposure is also a risk factor for having a heart attack. The nicotine in cigarette smoke reduces the amount of oxygen your lungs can send to your heart. It also raises blood pressure and speeds up a person's heart rate. Nicotine is also known to harm the insides of blood vessels and arteries and to increase the chances of blood clots forming. Drinking. Moderate alcohol consumption may provide some health benefits, such as reduce your risk of developing and dying from heart disease, possibly reduce your risk of ischemic stroke, when the arteries to your brain become narrowed or blocked, causing severe reduced blood flow, possibly reduce your risk of diabetes. Even so, the evidence about health benefits of alcohol isn't certain, and alcohol may not benefit everyone who drinks. Everyone produces a small amount of alcohol internally each day as part of the metabolizing of food. This small amount of alcohol is absorbed and burnt as energy. Drinking a small amount of alcohol can help some people because it helps to raise good cholesterol, HDL, levels, at the same time reduces bad cholesterol, LDL, levels. It helps to stop blood clotting, tends to thin the blood, and allows for easier bleeding that could help to hold off a heart attack, but only if used in moderation. High cholesterol. Cholesterol has been blamed for heart disease for many years. But it is now known that cholesterol is in fact healthy. It is one of the most important substances the body produces. After all, the body needs cholesterol to carry out its functions. For instance, our brain and liver are made of good cholesterol. Our body can produce cholesterol on its own. However, problems arise when we consume too much bad cholesterol, known as LDL or low-density lipoproteins. Eating processed sugars, hydrogenated vegetable oils, and too much omega-6 fatty acids can cause an oversupply of LDL. LDL helps to carry cholesterol around our body to the areas that need it. When there is too much of it, the excess can cling to the walls of the arteries, irritating and clogging them up, preventing enough oxygen-rich blood from reaching your brain, heart, and other organs. Diabetes. People with diabetes tend to have a high blood glucose level, which can, over time, damage your blood vessels and especially the nerves that control the blood vessels in your heart. Many people with diabetes can develop heart disease at a young age, and those with diabetes are almost twice as likely to have heart failure as non-diabetics. As with all heart conditions, if you take proper steps to manage your diabetes, your risk factors will substantially reduce. Physical activity. Doing very little or no physical activity is a major cause of heart disease and heart attacks. This is because they can't burn up excess, so it's turned into fat. The body is designed to perform a certain amount of activity daily to keep it supple, healthy, and function properly. When the body takes in more food and energy than it needs over an extended period, this will lead to obesity, which can lead to many diseases. The body needs exercise to stay in peak condition, which is a good way to ensure heart health. We'll talk about lifestyle choices for a strong, healthy heart. There comes a time in everyone's lives when we have to decide and commit to make healthy lifestyle changes. Oftentimes, it's when they realize that their body is starting to break down, in the terminal stage of a disease, or experience the pain of losing a loved one from ill health. These situations are often the turning point of their lives where they finally decide on the best course for them and their family. It's always better to live a healthy life, full of vitality, youth, and vibrancy, than to live a sick life that constantly relies on health support. Our environment plays an important role to our heart health. So if your living condition is not conducive for your health, such as living in a heavily polluted area with poor hygiene and health facilities, the best option is to relocate to somewhere else. Our body and heart forms an extremely complex organic living machine, far more advanced than anything man can create. But like all machines, it needs the correct fuel and lubrication to maintain it. Have you heard the saying that your body is your vehicle on this life's journey? Thus, you should honor your body more than anything else. Think about it. Would you put cheap vegetable oil in your new car, or try and fill the tank with cheap, dirty, old fuel? Then why would you do that to your body? You can always buy a new car, but you cannot get a new body. Well, maybe a new heart, but what a hassle and expense. Surely it's sensible to only use the very best fuels for your body. Of course, what I mean by fuel is your diet intake. Only choose the foods that'll benefit your health, not destroy your body. So, what are the best health exercises? There are a lot of benefits that you can reap from exercising. It can help prevent heart disease as well as diabetes, lose weight, and also improve your overall fitness level. The best and most effective exercise to achieve these desired outcomes is high-intensity exercise coupled with slightly longer periods of active recovery. This can be done by walking for 3 minutes at your normal speed and then walking 1 minute at a brisk pace. By raising and lowering your heart constantly through simple high-intensity workouts, you can have better vascular function, burn more calories, and also enhance the body's detoxification functions. Another good exercise for your heart is a total body non-impact sport such as tennis or squash, swimming or rowing, taekwondo, or other martial arts. All of these involve the use of many different muscles to give your body a good workout without overtaxing any one area, but making your heart work hard to supply them all. If you also incorporate some slow intervals, you will create your own ideal workout. Core workouts like doing press-ups and squats help to strengthen the core muscles, giving a good foundation. People who are active all day are generally healthier than those who exercise 30 minutes to an hour a day, then live a sedentary lifestyle for the rest of the day. But bear in mind that not all exercises are good for the body. For instance, jogging or running on a hard surface for long distances are probably the worst type of exercise, although they do strengthen the heart. It's because such endurance-type exercises wear the body out quickly and strain your joints in the long term, especially if you don't have a pair of comfortable shoes or proper running techniques. Equally, it's not advisable to perform any exercise that you've not trained or warmed up for. Doing so will only result in unwanted injuries and even trigger a heart attack due to adrenaline surge. If you have an exercise routine that you enjoy, then follow it and improve it by adding to it rather than changing to something you may not enjoy. How do you reduce stress? Countless studies prove that psychological factors can contribute to heart disease and possible heart attacks. Anxiety, anger, depression, hostility, as well as social isolation can affect your heart attack risk factor. Workplace stress and financial stress can increase your risk of a heart attack by 50%. After the 9/11-2001 terrorist attacks, it was found that people who felt high levels of stress just after the attacks were twice as likely to develop high blood pressure and had a 3-fold chance of developing heart disease over the following 2 years. Similar results have been observed after large earthquakes and other natural disasters. Now, let's talk about the importance of environmental conditions, clean air, and water. Water and air pollution are significant contributors to people developing heart disease and stroke. A stroke is like a heart attack to the brain. Staying indoors too often might not be as safe as you think because there's indoor air pollution. Pollution comes from a mixture of different contaminants such as fumes from household cleaning products, wood-burning stoves and fireplaces, secondhand cigarette smoke, vapors from cleaning products, paint solvents, pesticides, insecticides, and carbon monoxide. Exposures to low levels of CO can cause a cardiovascular patient to have increased heart rhythm, chest pain, and irregularities that make it difficult to exercise. Indoor CO can come from inside furnaces, dryers, gas water heaters, space heaters, ranges, and fireplace and wood stoves. There's evidence that several minerals commonly found in drinking water may contribute to heart disease or aggravate its symptoms. Lead, arsenic, fluoride, and chlorine exposure are all clearly associated with heart disease. We'll talk about remedies for a healthy heart. Many natural remedies use a variety of herbs and supplements to help treat as well as prevent heart disease. Arteriosclerosis, the hardening of the arteries, is a common cause of heart disease. This is found mainly in the Western world. However, arteriosclerosis is quite rare in the Third World due to its different lifestyles, traditional diets, and herb remedies. Coenzyme Q10, or ubiquinone, is a compound that helps our cells extract energy from food. This compound is often missing from our diets. Although coenzyme 10 is produced naturally in our body, the amount decreases dramatically as people grow older or have reduced cholesterol levels. So, coenzyme Q10 supplements will help you to ensure your body has an adequate supply to sustain your heart and keep your cells healthy. If you're not getting enough magnesium and potassium in your diet, by taking these supplements you can help regulate your blood pressure levels as well as improve heart function. As you may realize by now, salt has a very colorful history, both in the development of human civilization as well as public health politics in the past century. While salt was originally prized by many cultures for thousands of years, in the past century it has been demonized. Some have gone so far as calling it the single most harmful substance in the food supply. But new studies have shown that salt has little to do with heart health. In fact, it plays a crucial role in optimal health, and too little salt intake can be dangerous in the long run. Natural, refined sea or rock salt are a great source of minerals. It's become harder and harder to obtain trace minerals from the foods we eat due to the lack of nutrient-rich soil. However, trace materials are still abundant in our planet's seas and oceans, from which we get a variety of sea salts. On the other hand, table salt is mined from salt deposits underground. It's more heavily processed to eliminate minerals and usually contains an additive to prevent clumping. By choosing a real whole food salt that is worth its salt, you can enjoy the health and taste benefits a balance of minerals from the sea can bring to your favorite dishes. Fish oil and other supplements. Many supplements like fish oil are often of low quality and can be harmful. This is due to the extraction process used, which causes them to oxidize. It's important to access the quality before purchasing or taking any supplements. Normally, a good wholesome diet will supply all the needs of the body. The only time supplements become necessary is when your diet is lacking or when certain health conditions cause you to develop an insufficiency or deficiency. Most dietary supplements are safe, and some of them offer actual health benefits, but there can be some risk with their use. Some of these are also anti-nutrients. They prevent the body absorbing nutrients. Omega-3 fatty acids are essential nutrients that are found in naturally grown plants, free-range, naturally fed livestock, and sea-caught fish. Usually in nature, they are found in the ideal proportion for heart health of 50-50 with other natural fats such as omega-6 fats. Did you know that livestock such as eggs, dairy, and seafood lack many essential nutrients when they're raised in feedlots or factory farms without natural feeds or natural sunshine? They lack omega-3 fats and contain very high amounts of damaging fats, which is bad for health. So if you're not eating free-range organic foods, then taking supplements may prove beneficial in ensuring your body gets the nutrients it needs each day. Vitamins and their importance. Vitamin C is one of the safest and most effective nutrients, experts say. A daily dose of vitamin C may have a similar effect as walking on a protein called endothelin-1, which promotes the constriction of small blood vessels. The study, which was presented at the American Physiological Society's 14th International Conference on Endothelin, involved 35 sedentary, overweight, or obese adults. Those who took a daily time-release dose of vitamin C, 500 milligrams, reduced endothelin-1-mediated vessel constriction as much as those who walked daily. Endothelin-1 activity is known to be higher in those who are overweight and obese. Folic acid, or vitamin B, belongs to the family of water-soluble vitamins. It's essential to include this vitamin in your routine diet plan. The human body is capable of preparing this essential vitamin. Daily requirements of the human body utilize a part of this stored vitamin, and the surplus amount is released out of the body through excretion. It performs some of the most vital functions of the body, including everything from RBC formation to energy production. The health benefits of vitamin B9 include the prevention of heart disorders, stroke, cancer, and birth defects during pregnancy. It also helps in building muscles, cell enhancement, hemoglobin formation, and even provides relief from mental and emotional disorders. Vitamin B9 is naturally found in asparagus, broccoli, Brussels sprouts, and lentils. Enzymes in foods. Enzymes are vital for every cell in our body as they are organic, biological catalysts that start, promote, and speed up biochemical reactions. Metabolic enzymes in the blood break down the protein-based protection of viruses, parasites, bacteria, and fungi. They are cleansers that combat chronic inflammation, preventing most diseases, including heart disease. Our body produces many enzymes, millions a day, but we still need a good supply of fresh enzymes from fresh food. Antioxidants. When you eat a healthy, wholesome diet with plenty of raw, fresh fruits and vegetables, you get a good variety of enzymes and antioxidants as well as fiber. Antioxidants are molecules that give off electrons that help maintain the integrity of your cells. Antioxidants help to prevent cholesterol from oxidizing. Oxidized cholesterol is what poses the danger. It's very damaging to the cholesterol cells. Oxidation is the result of a normal body process, but if something triggers an overproduction of oxidized cholesterol, it can be dangerous. Your immune system may mistake oxidized cholesterol for bacteria. As your immune system then tries to fight it off, this can cause inflammation inside of your arterial wall. This can lead to atherosclerosis or heart disease. There are many recognized antioxidants, but one of the most well-known is vitamin E. Study after study has shown that vitamin E is a potent antioxidant that can help prevent and even treat free radical damage. Factory farming versus organic foods. If you've been following the news, you've probably already heard the phrase factory farming. This term refers to the type of farming business which keeps animals at high stocking densities and uses modern technology to facilitate faster animal growth, lower illness and death rates, and higher production outputs. Many people, particularly business owners and investors, think that factory farming is one of the best innovations of the modern times and has solved numerous problems in the society. However, there are also those who say that factory farming is harmful to the environment as well as to the health of both animals and humans. Poor quality ingredients and sometimes questionable processing and preservation methods are used. On the other hand, the term organic refers to the way agricultural products are grown and processed. While the regulations vary from country to country in the U.S., organic crops must be grown without the use of synthetic pesticides, bioengineered genes or GMOs, petroleum-based fertilizers, and sewage sludge-based fertilizers. Organic livestock raised for meat, eggs, and dairy products must have access to the outdoors and be given organic food. They may not be given antibiotics, growth hormones, or any animal byproducts. Hence, organic foods are more nutritious and much safer, which may translate to a healthier body that is able to absorb healthy nutrients. Detox, the real story. Our bodies, if given the raw materials needed, are very good at detoxing themselves. People who have a healthy, wholesome diet and refrain from indulging in too many processed foods will enjoy renewed energy and heart health. A small amount of processed food is not ideal, but the body can deal with it if not overloaded. Meditative cures, reflexology, and mindfulness. Psychological risk factors, including anxiety and depression, are clearly factors that can have a substantial effect on the heart. Stress can affect and increase the risk factors for heart disease and high blood pressure, especially if coupled with physical inactivity and a person being overweight. Meditative cures. Meditation can reduce the risk of stroke, heart attack, and death by around 50%, according to a new clinical trial. Scientists found that mental focusing and relaxation can be just as effective as the new superdrugs that treat heart disease. Balance may sound intangible, but there are chemical markers for every benefit that meditation brings. The negative effect of stress on the heart, as well as the recovery process from stress, is driven by the production of hormones and neurotransmitters throughout the body. Meditation has been found to be a powerful means of rebalancing and regulating these biochemicals. Mindfulness is about training yourself to pay attention in a specific way. In general, mindful people are more aware of the present moment and observe their thoughts, feelings, and behaviors without judging them as good or bad. They tend to disagree with statements like, "I find it difficult to stay focused on what's happening in the present," or "I could be experiencing some emotion and not be conscious of it until sometime later." Studies have demonstrated that individuals who are naturally mindful tend to have healthier hearts and a reduced risk of obesity. Reflexology appeals to many people because it's non-invasive. The only clothes to be removed are shoes and socks. The hands as well as the feet can be worked, and this allows discrete self-help relaxing techniques to be applied at any time. Reflexologists are trained to help balance the mind and body and to maintain this state of homeostasis the body needs to run smoothly. When there is a malfunction in the body, it's thrown off balance. Reflexology helps to sustain a natural equilibrium in every gland, organ, muscle, tissue, and cell in the body through stimulation of pressure points called reflexes on the hands and feet. To relax and invigorate your heart muscle, reflexologists suggest that you focus on the heart, colon, and pituitary gland reflexes on your feet. Try working these reflexes with your hands or feet, solar plexus, diaphragm and chest, lung, heart and shoulder, arm, neck, thoracic and cervical spine, intestine, with emphasis on sigmoid colon and adrenal gland. Superfoods for heart health. There are a lot of foods that have the properties to dramatically help with heart health problems, mainly because they are very rich sources of the nutrients and compounds that naturally purify arteries, cleanse and remove inflammation, as well as boost the immune system. Avocados are very high in healthy fats, and if eaten regularly, their compounds are able to normalize and stabilize blood cholesterol levels, maintain clear arteries, and eliminate clots. Asparagus has found to be a very effective blood cleanser. It's able to reduce blood pressure and slow the forming of blood clots. It's loaded with vitamins B1, B2, C, E, and K. Pomegranates have an impressive array of antioxidants that help to protect artery membranes. They also promote the production of nitric acid that allows a person's blood to flow more freely through their blood vessels. Turmeric reduces inflammation and the hardening of the arteries, as well as helping to keep them clear and reduce blood clots. Persimmon is a very good source of polyphenols and antioxidants that both help to reduce bad cholesterol, LDL, and triglycerides. They also help to normalize blood pressure and cleanse the arteries. Spirulina helps to regulate blood fat levels, normalize lipid levels, and contains necessary essential amino acids, which help to improve the immune system. Cinnamon is able to decrease harmful cholesterol levels and clean plaque, so it's unable to accumulate in the arteries and blood vessels. Broccoli helps to prevent calcium buildup in arteries and helps to reduce blood pressure and normal cholesterol levels. Cranberries are thought to decrease the risk of developing heart disease in most people by up to 40%. They have a high antioxidant content, which helps to increase HDL while reducing LDL levels. Green tea contains a large amount of catechins. These help to decelerate the absorption of cholesterol and improve blood lipid levels as they help to clear obstructions from arteries. Green tea also helps with cardiovascular health and enhances a person's metabolism. Thank you for watching this video course. I hope you enjoy this video course and benefit immensely from it. As a general rule, our body's overall health starts with taking care of our heart. If you're looking after your heart, then you will also be looking after the rest of your body. The decisions that you make regarding your diet and lifestyle will ultimately affect your heart health, your overall well-being. Not just that, your family will also be affected. If you're following a diet that consists of mainly processed foods, you're putting poisons into your body with empty carbohydrates and chemicals. Plus, if you're inactive in most parts of the day and live a sedentary lifestyle, you can expect to have a major health issue at some point in your life, and you'll ultimately reduce your lifespan. On the other hand, if you have a healthy lifestyle, take sensible precautions on your food intake, and are active in physical exercises, then you can expect to live a long, healthy life free of heart problems and many other chronic health issues that plague most people. This will allow you to enjoy your golden years in relatively good health.